Welcome to this series of YouTube training videos on patient diaries. This video has been put together by the Critical Care Psychology team alongside the Unit Patient Diary Champions, with thanks to Dr. Matthew Beardman for use of his teaching materials. Patient diaries have been widely used in critical care units in the UK, Europe and America since they were first introduced in 2001. They are a nurse-led intervention designed to reduce psychological trauma and to improve individuals' quality of life after critical illness and mechanical ventilation. Patients often describe having very little or having vague memories of their time in critical care. They will also often describe not being able to distinguish between what was reality and what they dreamed about, which can cause distress. Patient diaries form a daily account of a patient's admission, written in everyday language that includes aspects of their care, medical updates, key milestones, and descriptions of situations and surroundings in which the patient might find recognition in. It helps to start to fill in the memory gaps, blanks, and to help individuals understand their critical care illness. The diary will remain the property of the patient. It's not part of their medical notes and is written to help patients remember their stay. They also play a part in facilitating optimal rehabilitation outcomes, reducing psychological trauma, and can support bereaved family members. Psychological trauma arises when we are exposed to a traumatic event that triggers intense feelings of fear and helplessness or horror. During traumatic events, our brain processes sensory information differently. The amygdala generates intense feelings of fear or horror. Sometimes this can interfere with the normal functioning of the hippocampus, which would usually function to help us process information and form normal memories of experience. This can leave traumatized people with memories that are vague, fragmented, and lacking on context. Traumatized people may continue to relive the experience through flashbacks or nightmares. Traumatized people may continue to feel detached and numb, or may remain hyper-alert and feel jumpy, uptight, and irritable. They may try to cope by avoiding anything that reminds them of the experience. Symptoms of psychological trauma, post-traumatic stress, arise because of the way our brains respond to traumatic events and include re-experiencing the event through nightmares or flashbacks, feeling uptight, irritable, easily startled, and often unable to sleep. Also through avoidance of external or internal reminders of the experience. During an admission to critical care, there are various barriers to the formation of normal, complete, and coherent memories. People often only have vague and fragmented memories of what really happened to them. They are therefore at significant risk of developing psychological trauma. Some of these barriers include sleep disturbances, sedation, hallucinations, the impact of critical illness, delusions, and pain. Recent reviews estimate prevalence rates of anxiety, depression, and post-traumatic stress disorder, also known as PTSD, in discharged ICU patients at 46, 40, and 22% respectively. PTSD or depression occurs in approximately 1/3 of family members. What predicts psychological trauma? The single biggest predictor of psychological trauma in ICU patients is acute stress on the unit. Acute stress can be characterized by high levels of anxiety, hopelessness, flashbacks, hallucinations, delusions, and sleep disturbance. Therefore, it's very important to identify patients that are suffering from acute stress using IPAT questionnaire. An IPAT questionnaire can be found on the Critical Care Psychology referral form. Psychological interventions for post-traumatic stress or traumatic memories focus on addressing the trauma memories and the thoughts and feelings related to the traumatic time. This helps to process the fragmented and disjointed memories by creating a coherent narrative. To recover from psychological trauma, patients need access to clear information about what actually happened to them so they can piece together a coherent timeline. Patient diaries are one way of giving patients access to this information so they can elaborate and make better sense of their fragmented and incomplete memories. Reading a diary may be distressing for the patient in the short term. In the longer term, this helps patients to reprocess their fragmented memories, to reduce flashbacks and achieve better physical and psychological health outcomes. The diary will remain the property of the patient. It's not part of the medical notes and is written to help patients remember their stay.